what is fatty liver and how does it affect your body. Hello, hi, and welcome to the channel. My name is Dr. Zubin Dev Sharma. I am a gastroenterologist and a hepatologist. In this video, we will try to cover the very basics of what is fatty liver and how does it affect your body. So to understand the concept of fatty liver, the first thing that you have to understand is what does a liver really do in your body. So liver is the principal seat for all kinds of metabolism in your body. Its predominant work is to break down the absorbed products into their core forms and then use that to develop various kinds of proteins, and those proteins are used in your body. So when you say fatty liver, what does it really mean? Fatty liver means there is a certain amount of fat deposits in the liver in various forms, which leads to a malfunction or decreased function of your liver. So it's principally a kind of a marker for something called as metabolic syndrome in your body. The other factors in metabolic syndrome are things like diabetes, things like blood pressure, things like heart problems. All of them come together into, contributing to the metabolic syndrome, of which fatty liver is also a part of. Earlier, fatty liver was predominantly a finding for which you could have various causes. The various causes mean the first one, as I told you, the most common one, that is the part of being the metabolic syndrome. There are other causes, things like alcohol, things like some medicines, things like, some syndromes, some congenital, which you may have fatty liver. But the predominant thing, the common thing that we usually see in our practice, that we usually talk of, is the fatty liver because of fat deposits, because of metabolic syndrome in your body. So how does fatty liver affect your liver? So in the beginning, your liver has enough regenerative powers, enough reserves or resources to really not cause any problems to you physically, even if you have fatty liver. But over a period of time, let's say for years and years, some of these patients who have fatty liver will develop abnormalities of the liver in the form of early cirrhosis. When I say cirrhosis, I mean that the liver is now significantly damaged enough not to really function well in your body and not to be enough to support your body, and subsequently they will develop all the complications of cirrhosis. In fact, in current era, the number one disease in the world for liver is fatty liver. The nomenclature of fatty liver has recently changed from what we used to say a non-alcoholic fatty liver disease to a metabolic associated steatotic liver disease. That simply means is that we now understand and we now acknowledge that it's not just one factor which leads to fatty liver, there are multiple factors. And when there are multiple factors, you have to identify reversible factors in amongst them and try to treat. Next thing usually is what is asked is, what should I do if I have fatty liver? First thing is that you should not get alarmed. Having fatty liver does not mean that you should be alarmed of something. It just tells you that yes, I need to work on it today so that my future is secured and I don't have problems later on in my life. Fatty liver tells you that your body may have some insulin resistance, so you need to get physically fitter. You need to really act on your body. How does I treat my fatty liver? How do I treat this? Because the number one thing is that you have to start becoming more physically active. You need to have a healthier lifestyle. It is a lifestyle disease after all. So ultimately, you need to change your lifestyle. You need to start exercising. You need to modify your diet to some extent that you don't really, have too much of fats or even too much of carbohydrates in your diet. The principal focus of your diet should be a high protein diet. If you are a non-vegetarian, you can start with more amount of non-veg. If you are vegan or vegetarian, you can start with more amount of plant-based proteins. After that, there are certain parameters when you need to have a medical therapy or some medicines for fatty liver. You need to consult your hepatologist when you really see whether you merit only lifestyle modifications or you merit lifestyle modifications and some medicines for it. Your hepatologist will order some tests for you, which may include some blood tests, which will include an ultrasound, which will include a fibroscan of the abdomen. Rarely it may include a CT scan, MRI or an endoscopy. Once those tests are done, he will be able to tell you whether you really need to take some medications or not. But principally, you have to understand that lifestyle modifications are a must. When you say lifestyle modification, how much weight loss or how much running do I need to do? Running or jogging or any kind of aerobic exercise which you can do. It should be enough to really stretch your body for at least for that day. As far as weight loss is concerned, you should be limiting yourself to around 4. That depends on what is your underlying weight, but ideally you should not be losing more than 3 to 5 kgs in a month if you are really overweight, and it should be sustained over a period of time, and it should not be we're trying to lose 10 kg in 1 month. In fact, that will worsen your fatty liver if you try to lose your weight too. And of course, if you take alcohol, other drugs which can affect fatty liver, that should also be avoided. So if you have fatty liver, do take it seriously. Don't be warned, don't be scared. But yes, talk to your hepatologist. He may be able to guide you on what exactly you do in your case. But as I understand, it's a very common finding, but it needs to be managed like any other thing. So in case you have any doubts on fatty liver, please feel free to ask us. We'll definitely answer. Thank you.